Hi, thanks for joining us for our virtual event. I'm Dr. Megan Couvillion. I'm a board certified dermatologist here at SBA Dermatology and Plastic Surgery. And today I'm going to talk to you a little bit about how I use fillers in my practice. Fillers are a tool that we have that can provide fairly rapid results. And there are kind of two main types of fillers that I use in my practice. We have the HA fillers, which are the fillers that probably most of you have heard of. This is going to be things like RHA, Restylane, Juvederm, and these are made of hyaluronic acid. This is a natural compound that's found in our skin. It's formulated into gels, and this can allow us to re-support areas that have lost support or provide a lifting effect to the face. They also can be used to soften lines or enhance certain areas directly, like the cheeks or the lips. HA fillers, you often see the result right away, and so a very gratifying experience to have. So generally, while you see the result right away, you do have to give it a couple of weeks to let all the swelling and bruising go down. We also have a category of fillers called biostimulatory fillers, and this is kind of a cool concept. So, we know over time that our skin does naturally make collagen, elastic fibers. This is what gives our skin its elasticity and buoyancy, and we lose some of this over time. So there are fillers designed to really rev up your skin's engines and to create more of this collagen elastic fibers. The one that I like to use a lot in the face is called Sculptra. So this is made of poly-L-lactic acid, or PLLA. So there are these tiny little crystals that are suspended in sterile water and in some numbing medication, and it's injected into the skin. But rather than doing discrete areas where we're really trying to lift or necessarily smooth a fold, it's injected more broadly in the skin. So this is something that can be done in the temple, it can be done across the whole cheek or in the nasolabial fold, in the chin area. It's injected, that liquid is absorbed by your skin, and then those little crystals of PLLA help rev up your skin's engine to build more collagen. So it's a result that takes time because we're relying on your skin to really get the bulk of the result. And over 4 to 6 weeks, you get this subtle building. One thing I really like about using these biostimulatory fillers is not only can we get some revolumization of the skin, but it often makes the skin look nicer in texture, so you get this skin boosting effect. And it also helps restore some of the elasticity of the skin. And so you get this kind of shrink wrapping effect, which is really nice because we know that our skin's just changing in 3 dimensions over time. And so being able to not just re-support where we've lost support, but get it to actually tighten is a really nice benefit. So how might we use this in my practice? So I use both of these treatments, and sometimes I use them in the same person. The way I like to go about it is if there's a need for, so say when you come in for a consultation, there might be a discussion where we look together and maybe the concern is, oh, I just feel like things are kind of falling down. And if we look at the cheek area, if there's a loss in the cheek here, we might re-support that by putting a little bit of filler back here, a little bit towards the front of the cheek. And do that first. That way you're seeing that more immediate benefit. But then once we've really re-supported all the areas, maybe a sprinkling of a vial of Sculptra kind of throughout the cheek or in the other areas if there's a need to really maintain the skin and help it stay really elastic and beautiful. So a common concern that I hear from my patients when we're having a consultation is, well, I really just want to make sure that I'm going to look like myself. And I think that's a really important point to hit on, because the goal is not that you look like someone different or that we change the proportion of your face when we're talking about doing fillers. That's why I think it's really important to have an individualized consultation. And whenever I do a consultation, for example, I think an area that can sometimes look overdone is the cheek. And the reason why I think this happens is that it's true that if we continue to add volume in the cheek, it can continue to lift the lower face, but then you start to see some proportion changes. So it's not just important to look at the face in the frontal view, but also from the side, and to think about how can we give the most lift while respecting this person's anatomy and how their face is made. And so that's when I like to really combine some of these types of fillers and think about not just filling the cheek in the front, but also on the side of the cheek Sometimes we also look at the temple area, or is there an ability to lift from back here in the hairline and get an improvement down here? So we really take into account those things. And I also like to consider what I want to achieve for the patient and also what I don't want to achieve, which is you looking too cheeky when you smile. And so that may have to do with what type of filler we pick for you and also where the filler is placed. These are procedures that not only can give my patients great results, but things that I do for my own skin because I see how great the results can be. And these are things that I believe in. And of course, I'm not going to recommend things for patients who are looking for me to help, or things that I wouldn't do myself. So if you're curious, the things that I've done over time, most recently, I had a vial of Sculptra, and that was to help with overall skin elasticity and a little bit of volume loss. And that was in the cheeks, in front of the cheek. And this is an area that I think a lot of people don't recognize can really help lift in someone who is thinner and whose loss is found in front of the ear. Also a little bit in the nasolabial fold and the bottom of the cheek. The procedure itself takes 15 to 30 minutes, depending on how much we're doing. Pretty comfortable to get through. A little bit of swelling, a little bit of risk of bruising. Mine wasn't bad at all. And then I saw my collagen building by about 3 to 4 weeks from then. I've also used hyaluronic acid-based fillers, although not quite as recently, to help restore some volume in my cheeks and around the mouth area. And part of what I love about these products is that we can do small amounts to correct smaller changes. So we can really tailor the plan to each individual person. So you'll see a demonstration of Sculptra injection shortly here on the screen. Sculptra can be injected in one of two ways, either with a needle or here I'm using a cannula. So this is a technique where I can actually reduce the risk of bruising and swelling. That means that a tiny little opening is made in the skin with a needle, and the patient's already had topical numbing medication on the skin, so she feels minimal discomfort. And then through that little tiny opening, a non-sharp cannula is threaded. In Sculptra, you'll notice that it's kind of threaded throughout the area in small amounts, and that's to really give all of that skin that PLLA that we're going to use to help build collagen. Thank you so much for participating in our event. Don't forget to call this week to lock in your savings, and hopefully I'll see you soon here in the office.